So if some family comes to you wanting to talk about puberty blockers or hormone therapy for their young person, what's the first step there?
So obviously exploring that with the young person in the family and seeing what they were wanting and what their timeline was. But in practical terms, probably the first step is to get a thing called a psychological assessment called a readiness assessment. I think there's been some nervousness in the community, would that be fair, around those assessments in the past because they were seen as a gatekeeping thing that stopped people, getting to the goal that they, are very clear that they wanted to get to. Um, and there used to be multiple assessments that you used to have to do, and you had to really prove that you were mentally very well, essentially. And so I just really need families to understand that that is the absolute flip opposite nowadays. So the readiness assessments are in Canterbury, done at the University of Canterbury Psychology School. So away from mental health services, that also done by some private psychologists that have an expertise in this area. And I say to families and to young people, they're really just a lovely few hours chat about yourself and to find out what your needs are, what areas. You don't have to be perfectly mentally well, because who of us is? And if, for instance, you do have some anxiety or low mood or other problems, maybe even learning needs, so those will be supported as part of that readiness assessment, so that hopefully you walk away from that assessment with a greater understanding of what your needs are going forward, not as a you're not well enough or this is a yes no to whether you can have hormones or not. So
And that's kind of how gender affirming care as a system has shifted in the last little while, in general, right? So moving away from this really kind of pathologizing model where you had this gatekeeping approach and this idea that you had to meet certain thresholds and criteria, and I think in the community those assessments were kind of seen as like a test as to whether you were trans enough to access care, right?
Yeah.
And I think how you phrase it, that it's kind of totally flipped now, is true, not just for young people but for adults as well. And how we approach gender affirming care is kind of like a collaborative project between us as patients walking in to meet a GP and a clinician, working together to make sure that the trans person has what they need, that they're really well supported, that they understand kind of what they need in terms of their mental well-being and social support and other areas of their life, and you're kind of working together to figure out what's best and right for them in terms of what their goals are and their transition medically, as well as their social life and mental well-being as well.
Yeah. And I think as I'm listening to you say that, I couldn't agree more. But I also think you need to say to families, don't expect the very first GP you approach necessarily to be the perfect person. There are definitely some clinicians that have more of an interest in this area, the same way there are for clinicians for, sore knees or for anything really. Different people have a different expertise area. And so if you approach a GP and they really don't seem to know what is going on, that certainly in Canterbury, and I think nationally there are different systems in different towns, but you can ask for a referral to a GP with an interest, and so your GP will send a letter to that GP, and then you'll be asked to come in. So that will be for a gender affirming care with somebody that actually knows what's happening in the system and what how they can help best, essentially. So just keep asking, I think, is the thing for parents if you're not quite getting there the first time.
Yeah.